The politics of the Affordable Care Act are about to change. That's because the individual mandate is about to become law in 2 weeks. Americans have an obligation to follow the law, and members of Congress have a duty to uphold it. And that includes congressional Republicans.
We have never encountered a situation in which we had a law that was so widely despised by the American people.
If they really want to fix Obamacare, they would join with us, repeal it, and start over.
This fight, this debate will continue until collectively the American people can make D.C. listen.
No, not exactly. If people start listening to what's happening on the ground. So let's look today at the policy itself, because you know what's more important than all this politics? Whether this policy is working for Americans. And to figure that out, I think we should check whether it's expanding coverage with private insurance, expanding coverage through public programs like Medicaid, controlling costs, and preventing corporations from discriminating against patients. Because remember, those are the law's goals. And here's some good news. It's working. Discriminating against patients is now illegal, and costs are actually more under control now, as the New Yorker reported last week. And then there's expanding coverage, which got off to a slow start in October, as we know, but we now have numbers for October and November, and the trend line is clear. Coverage is expanding for each category, state, federal, and public care. Yes, my friends, the Affordable Care Act is working. This success is so important, it's worth thinking about it in one other way. Contrary to all the GOP attacks on this law, there is no Obamacare health plan. There is no Obamacare doctor. The ACA isn't even a government health plan. Remember, it's a set of rules providing a bunch of different ways for Americans to get care. So let's look at those rising numbers again. Here are all the federal enrollees, as you see in blue. Then people getting covered from participating state exchanges. And then all the new Medicaid coverage. That's now 1.2 million people total headed for coverage. It doesn't matter whether they go through door number 1 or door number 2, or whether they use a website or the telephone or a local navigator guide. What matters to them, and to a lot of us who care about the uninsured crisis in our country, is that they get covered. This is progress. But it's not like everyone knows these facts. And sometimes it feels like there's more coverage of the website than coverage of, well, yeah, health coverage. That's partly because of Washington, and it's partly because of the media, and it's partly because, look, broken website is an easy story to tell. The ACA is not. It's complicated because it amends and regulates an industry that was already complicated. The U.S. doesn't do government single payer like Europe. And the U.S. doesn't use a model where the only way to get care is if you're rich enough to buy it, like the Ayn Rand fan fiction in some of the bills coming out of the House. No. We do a convoluted mix of private and public, of federal and local. And when you add all of that to a hybrid system, you end up adding to each layer. So people have coverage options from door number 1 and 2 and 3. And thus, it's not surprising that sometimes the simplistic pessimists win the spin war over the nuanced reformers. But my friends, believe it or not, I think the spin war is winding down because this law is now being implemented, and this law is working. And in that environment, facts become the new spin, and the facts are on the side of the people following the law and expanding health care coverage. It's not easy, and no, it's not simple, but it's far more worthwhile than hating on the largest health care breakthrough we have had in a generation.